Hey YouTube, my name is Marida. Welcome to the Nurse Lounge. And today we're actually going to talk about what was nursing school like for me. If you want to see or hear what my story was or what my nursing school program was like, stay tuned. And we're back. My name is Dr. Marida P. I'm a registered nurse. I've been a nurse for almost 17 years. My specialty is OB/GYN, well baby nursery. I am a nurse educator. I'm on break at the moment. And I am teaching at a HBCU and I'm doctorally prepared. So now that we got that out the way, let's kind of dive on into what my nursing school experience was like back when I went to nursing school. So for you all who are younger, in terms of more younger than I am, I'm 43 years old. I went to nursing school. Let me set the tone for you. So when I went to nursing school, I finished my bachelor's program in psychology in 2002 and realized that that program was not going to be, or that degree was not going to be for me. In terms of me making money, I was on government assistance and all this other stuff, okay? I had two girls at the time. So I was 22 with, two children. 22 with two children at the time. So by the time I graduated, I think I was actually 24 when I graduated from my BS in psychology. So the year before I graduated, I realized this was not going to be enough. I finally matured, I guess, and realized that this degree was not going to be substantial for me in terms of taking care of my girls at the time. So I opted to do something else. So I finished that degree in psychology and decided to then start nursing school. So I graduated in May of 2002 for my degree in psychology. I had applied for 3 different schools for nursing, and I got accepted all 3. What made me choose the school that I went to is because all the other schools required prerequisites, and the one that I chose, the prerequisites were less. I only had less credit hours. I had to do 12 hours of prereqs, where some of the other schools were like 29 hours to get into their program with another degree already. Most of my hours or credits transferred from my bachelor's degree in psychology to my nursing degree. So I didn't have to retake any of those classes. I just had to take classes that I was lacking for their program. And the classes that I was lacking at the time was chemistry 1 and 2 and microbiology and its lab. Chemistry 1 and 2, their labs, and then micro and its lab. I had to take all of those classes in the summertime. If you know how a summer semester works, you know those classes are very, 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 very fast paced. And if you have a science class with the lab, it's even faster and even harder. So I took 3 science classes, and I took their labs in an 8-week period of time and passed those classes and started nursing school that August. So get the timeline. May 2002 graduated. June, July, I'm taking science classes to fulfill the requirements for nursing school. And then boom, August, I started nursing school. So it was nonstop, just like that. Me, single parent, 2 little girls. That's how it was. Now, I get to nursing school, and I remember my first day of nursing school and remembering that at that point in time, they took 80 students per year. So if you didn't get accepted within that year, you were done. I taught at that same school up until last year, and they now take every semester, like 60 students every semester. But when I went, they only took 80 per year. So if you didn't get in that year, you had to wait until the following year to get in. So I got in that year. Within the first week of class, 7 students had already dropped. That's how hard it was. Nursing school is no joke. So the ones who think that they're going to get by on nursing school on their looks, or get by because they made good grades and they general ed classes, no, this is a different beast altogether. So be mindful of that. Different beast altogether. I didn't fail any classes. However, the way our program worked was you took a dosage calculation exam every single time that you had a new class. You had to have a 76 average going into every clinical day. So let's say, for instance, I have a test today and then I have clinical tomorrow. If that test today brought my overall average in that class below a 76, I did not go to clinical tomorrow. That's how nursing school was for us. And when that happened, you only had 2 chances to do that before you were kicked out of that class. You only had 1 time to retake a class. So you have all these classes that you have to take, and then you have to pass them all. So you only have one lifeline. That's what I call one lifeline. If you fail a class, you can take that class over again, but keep in mind that class ain't coming back around for another year, right? So if that's the case, you have to wait another year before you can get back into the program, because you can't continue on until you pass that class. All classes, semesters build up on the previous semester. So we tried our best not to, mess up anything. One thing I will say that I didn't know at the time, but of course I know now because I teach it, is that usually your specialty classes are taught your senior year. Those are the harder classes. Your specialty classes are. So you need to get to that senior year, because if you mess up, you can at least mess up towards the end. For me, there was no messing up. I had to take care of my girls, and I was on government assistance, and this is my 2nd degree at this point in time. I have to get it right. So there's no messing up for me. So, and I did fine with all my classes. I got A's and B's in all my classes until we got to OB. So we got to OB. My oldest daughter at this point in time was 5 years old, and she was going to go to kindergarten this year. And our policy is you don't miss no class, you don't miss no clinical, you don't miss nothing. You got to be dead or in the jail or in the hospital. One of those 3. That's the only 3 issues you could have, and it would be somewhat excused. Otherwise, you have to attend everything. So some of y'all who making doctor's appointments, and I have students who do this, and wondering why they get a 0. But anyway, I digress. Making doctor's appointments while they are supposed to be in clinical, they didn't play that at our school. So I knew that was the policy, which was fine. So what I decided to do was, I'm going to be at my daughter's first day of kindergarten. She will never get that day back. I will never be able to make up another first day of kindergarten. So I saved up. I went to every single class because I knew I was going to miss that class. And I got wrote up as the syllabus states they're going to do. And I was fine with that. It's kind of like when you all, when we try to save our sick days for when we really need them. That's what I did. I saved all my days and make sure I went to every class because I knew that day I wasn't coming. And so I got wrote up, and actually it was about 5 of us who actually had kindergartners at the time. We all got wrote up. But that's the policy. So what can I be mad at? It's in the syllabus. I can't be mad. One thing about my instructors was they were all older and they did not play. I wish we had that same type of instruction today, where we take those principles. I'm not saying being mean. I'm not saying that. But I'm saying where we have a policy, we have standards, and we have structure, and we adhere to that, and not worried about trying to be students' friends, because I'm not worried about that. I don't need students' friends. I'm not here to be your friend. I'm here to educate you. So that was clearly understood in terms of that authority figure. It was understood that you did not play. You didn't call these people by their first name. They were Dr. such and such or Miss such and such. That's what you called them, or Mr. such and such. That's what you called them. You didn't call them anything but that. And today's students are very, very different. They just didn't play. They would look at you just like a parent would. Your mama would look at you and you knew what that meant. They didn't have to say nothing. My instructors were the same way. When we were in clinical, we had this one lady, I'm not gonna call her name, but she was had these piercing blue eyes. And when she looked at you with them blue eyes and she would squint like such, you knew you was in trouble. And we were terrified of her. So you did not want to do, I'm not saying it was good, I'm just saying that's how it was, and she didn't play, and believe me, we got through that clinical. So did I have any problems in nursing school? People often ask, well, did you have any problems? Did you struggle? Yeah, I struggled a lot. But the one thing about me was I'm going to make it work. I'm not going to complain. I'm not going to sit there and make excuses to why I didn't do something. If they told me to read pages or chapters 1 through 10, I read chapters 1 through 10. I don't play that. Well, which part do we need to know? They didn't give us study guides back then. There were no study guides. So any of y'all getting study guides today, really they doing you a disservice, but that's neither here nor there. They did not play. You learned the material. You knew how to take care of your patients at the end of the day. I was well prepared for taking care of my patients. So the one class that almost took me out because of that policy I told you about, if you had a 76 going into clinical, you did not, or less than a 76, you didn't go to clinical. Well, my labor and delivery test, the labor and delivery test failed, we took 2 labor and delivery tests. And we had, I think, 40 students because they split us 40 and 40, or what was left of us. So maybe like 30 and 30 or 30, whatever it was. So part of us went to med surge, two, and part of us went to OB, and then we flipped the next semester. When I went to OB, there's about say 15 to 20 people in our class. After those first two tests, they failed and they had to drop the whole class. So they only left 15 of us in the class. I barely made it through that class. Now, ironically, that is the same class that I teach today. I teach OB. OB is very hard, but that is my passion. That's my love. And I teach, and like it's a hard class. It's a very hard class to pass if you're not cheating and if you're doing exactly what you're supposed to do. If you're learning the material, it's a very hard class to pass, but it's doable. Most students make B's and C's in my class, and that's pretty average. So be mindful of that. Also, so that's the class that almost took me out. It almost took me out the program. Here I am, though, teaching that very class. And then my last semester of nursing school was Adult Health 2, and I went and did that, did my preceptorship in OB, and then I finished nursing school with a 3.0. So I didn't do the best, I didn't do the worst, but I did finish with a 3.0 in nursing school. And I did fine. I came out, and it was understood that you took your boards within usually a couple of months of graduating. Now, let me tell you, we had this test called the HESI. So a lot of people are familiar with the HESI and what it does and what it's for. We had a test called the HESI, and the HESI basically was our exit exam. Again, this is 2004. So it was an exit exam for us. And when we took our exit exam, it took me 3 times to pass the exit exam. And the class was, or the exam was actually tied to a class. It was tied to our leadership class. And so it was tied to our leadership class, and meaning that I had an A in my class, but if you did not pass the HESI, you had to take an incomplete, because that was the only thing from holding me from passing the class. So it was tied to the class. It wasn't part of the grade, but I had an A in the class, but until I passed that HESI, I had an incomplete. So I had to take an incomplete for that. Now, what was ironic was they actually allowed me to graduate and walk. So I walked in May. Knowing I really hadn't finished the program yet, because I still had that HESI to retake. So I took the HESI the first time, failed it. In May, I had to retake the HESI again, but I had to go to a remediation course, and they paid for the remediation course. So I had to come in for a week and go to a Kaplan remediation course. And then after that, took it again. My score was higher, but I still failed it yet again. So then they allowed me to know what areas that I need to focus on. So I went and started doing NCLEX questions every single night. They said, do NCLEX questions every single night. And I did that and went back over the material that the Kaplan representative told us to go over. The third time was the charm. I actually passed the HESI and actually blew it out the park at that point in time. And then went and sat for my boards in June, late June, I think July, actually. I sat for the boards in July. And then I actually got my license at the end of July. July 31st, actually, is when I became licensed of 2004. So that's my nursing in a nutshell. It was not, compared to nursing today, I would have to say our instructors did not play. If they told you to be here at a certain time, you were there at a certain time. We were all white. If they made sure that your underwear, you couldn't see their underwear through your clothes. You had to be clean. We actually went to clinical sites the day before to get our patients, get our information. I stayed up all night trying to do care plans and med cards or drug cards. That was how nursing school was for me. That, and I had, again, 2 little girls, single parent. So don't nobody tell me what can't be done, because I did it. It was hard. But the thing about me was, or that I am today, is that I am always determined to do what I need to do. I don't make excuses. And that's what my students do today. Well, no. If you want the program bad enough, if you want to be a nurse bad enough, you will not make excuses as to why you didn't do something. You have to come correct and be ready to do whatever needs to be done. You have to go to clinical, so find somebody to take care of your kids. Have that stuff worked out before you go to nursing school. Don't come up like, well, I have kids. Okay, that's not this nursing school's problem. That's not our problem. That's not their problem at all that you decided to have kids or that you have kids. You have to come in with a plan on your own already. So be mindful of that. And so I didn't have excuses like that. Well, I don't have nobody to pick up my child. Or when, inclement weather happened and the daycares were closed or the schools were closed. I had a plan. You have to have a plan. That's what made it so, I won't say easy, but easier, because I always had a plan for my kids no matter what. You can never use an excuse as to what you can't do when you already knew what your situation was coming into the program. And that's something I never did, or we never did back when I was in nursing school. We never made excuses because they didn't allow them. And I think that's what's lacking today, that we always giving in to people saying, well, okay, this, that, and the other. This is how the program works. This is what it is. And you're either going to do it or you don't. And if not, you can find another program. That sounds cold, but that's the truth of the matter. And at the end of the day, you have to understand that what are you doing? You're not taking a test just to pass a test. You're taking a test or knowing this material so you can take care of people and make sure that they don't die on you or they don't get worse from you, your care. That is the thing. So stop with the mindset of thinking that I am trying to take a test to pass a test. No, you're taking the test to know the material to take care of patients. And if you don't think of it like that, don't nobody want you taking care of them. Point blank, period. Don't think, well, I'll get to the NCLEX when I get to the NCLEX. Nope. You go in there every single day preparing for that NCLEX. The NCLEX is just your big old test you take at the end to say, yes, I'm safe to practice and I can practice as a nurse. Be mindful of that. All right, I'm off my soapbox. That's how my nursing school program experience was. Comment yours below if you've been to nursing school or if you are in nursing school now. Comment your experiences down below. Oh, one more thing. People have asked me, did I experience racism in nursing school? And the answer is yes. So when it comes to racism, it wasn't from my instructors, believe it or not. I went to a PWI, predominantly white institution, and I would think maybe I was one of maybe 3 or 4 minorities in the whole program, the whole 80 of us. So I'm used to that anyway, so it didn't bother me. But I want to say that, yeah, there was racism, but it wasn't from my instructors. At least it wasn't overt anyway. It was from the other nursing students. That right there is what will take you back. The other nursing students won't help you. And I think that's what I experienced when it comes to racism. Those issues that I had was with them, not with the actual instructors. Were they racist? They could have been. I don't know. But if they were covert racist. They made sure we got through the program. I always say the most of these programs, you have to understand the only color most of them is green. That's green for money, okay? Nursing programs bring in money to the institution, to university or to the college or whatever it happens to be. That's the color that they see is green. They got to get you through the program. Now, are there racist nursing faculty? Of course there are. There's racist everything, okay? Not nursing, police, doctors, everything. So why would there be any different in nursing school? That's just what it is, okay? So with that being said, if you have any other questions about how my nursing program was, clinicals or whatever, definitely comment those below. I'll make a separate video for that. But follow me on IG. It'll be here. Follow me on TikTok. It'll also be here. Until the next time, you all take care. Bye-bye.